I'm Dr. David Haase, and I'm so excited to show you what I think is something so cool. This is the MaxWell DynaMatrix Tensegrity structure, and I'm going to show you how to put it together. This kit has been something that's been a labor of love for us because I want to help everybody that is enamored with this amazing body that is a system of systems to better understand systems and to shift your mindset. I'll tell you, this little model has helped change how I see the world. I think it's going to help do that for you as well. And even if it doesn't do that, it's just a lot of fun. So without any ado, let's take a look at this. So this is this kit comes with a little tube. Inside are 4 dowel rods and some rubber bands and a whole bunch of little end caps. And we're going to do something amazing with this. All right, so all these pieces have come out. The first thing I want you to do as we're talking through this is we start taking a rubber band and there's this nice little slot inside each one of these dowel rods. And I want you to put a rubber band in each one of those slots so that it's just stretching. And you'll see there's some words on here. We'll be talking about that as we go through. But the first step is to just take each individual dowel rod and make sure you load it with a rubber band. Now, we're making a tensegrity structure. This was the term tensegrity was coined by Buckminster Fuller. And you can kind of think of this as the architecture of like the Epcot Center. This is a remarkable system that we're going to build. And the components of a system are always 3 pieces. Number 1 is substance, and that's recognized by the dowel rod. The second is energy, and that is represented by the rubber band. And the third is information, and we'll show you where that comes later. So as you start putting this together, you're going to recognize that there are 6 different colors here. We colored them differently so that you could help see the complexity when it's completed, and that you can recognize that these individual parts are going to do something amazing. Because what is a system? A system is something that is greater than the sum of its parts. And as we put together this tensegrity, we're going to see that start to emerge. All right, so now we have 2 dowel rods with rubber bands. I want you to find the middle part of one of these dowel rods, find the notch at the end of another dowel rod, and in the very midpoint, I want you to insert one into the other. Then you're going to take an end cap and you're going to put it on that dowel rod, because every one of those slots is going to have 2 rubber bands coming through it. Now you're going to flip it over and you're going to come to the other side, find another dowel rod, and put the rubber band into that slot. Put on another end cap, flip it over, and now we're going to take the rubber band, put it in the middle of these 2 dowel rods. Ta-da! Get a couple more end caps. Put that on there. Put this on here. And now you can see that we have something interesting starting to happen. But there's no real structure. Nothing's holding this apart. It's just like a big H. So now the next step is we're going to pick the midpoint of one of the rubber bands that does not yet have a dowel rod attached to the midpoint. Attach it there. And these end caps sometimes need just a little bit of wiggling back and forth to get them on. Spin it around. Put another dowel rod on here. And pretty soon something amazing is going to happen. Because we're now going to take this last dowel rod that has no middle connections, we're going to pull it out this direction. And voila, we now have a three-dimensional structure starting up. And we're going to take the other dowel rod and load it in here. And so now we have an additional three-dimensional structure occurring. Now, the last step, which is really fun, now you're going to insert the dowel rod here in the middle of this rubber band. Insert the dowel rod in the middle of this rubber band. It's really getting pretty, isn't it? And now you still have this two-dimensional, largely two-dimensional structure. And then we find that last dowel rod that has two rubber bands that are not attached to anything, pull it forward, find the midpoint, and now attach that. Come over here, find the dowel rod with the remaining rubber band that is not attached, put the midpoint in there, and you have created your first DynaMatrix. I call this a DynaMatrix. So the Tensegrity is what Buckminster called it. But what this symbolizes is a complex dynamic system. The individual pieces have become something far greater than themselves. And I remember I talked to you that every system has three parts. It has something of substance, it has tension or energy, and now we have information. We have the relationship of different pieces to other individual pieces. This, believe it or not, is a good map for your musculoskeletal system. So the dowel rods will represent your bones, and the rubber bands represent your fascia and your tendons and ligaments. And so because your entire, what's the old song? Your leg bone's connected to your thigh bone. Anything in the body, everything in the body is connected to everything else. And what's really remarkable is that when you have a stressor happen in the body and you get something pushing down, the entire system changes, right? A stressor in one part is distributed over the entire system. We all know this. Like when we get a rock in our shoe and we have to walk funny for some reason, it affects the direction of everything up and down the spine. All of a sudden, people who have forgotten a shoe lift in one shoe will start getting headaches because they're off balance. That balance exists in every other part of your body as well. If you take a look at these dowel rods, we'll see over here, this one says immune. This one says detox. This one says gut. This says energy. This says hormones. And all of these aspects of your physiologic functions in your body interact together. When one is out of balance, it's going to pull the rest out of balance. When one of them, so it is not any one thing that's important, it's the whole of the system. And so when we're taking a look at a systems medicine diagnosis, we're looking at the entirety of the person, the entirety of their life situation. And we're looking for where something might be blocked, where now this is not movable. It's not as resilient as it could be. It doesn't have the ability to adapt because it's been constricted. When we have dysfunction in our gut, for instance, with a lot of inflammation or maybe food sensitivities, then what happens is the entirety of the system is altered. So this is why precision diagnosis and precision treatment is important, because now you can release that and the system as a whole can start bouncing back in a way that it couldn't before. It's really remarkable. I mean, a system is incredibly dynamic and resilient. It's always in motion. This system of your body is never truly still even if you're sitting really still, your blood's pumping, your cells are vibrating, your mitochondria are doing their job. We always have the matrix of our body functions in dynamic relationship with each other. So we call that a DynaMatrix. I've also put some other words on here. So behavior, body, being, belonging, brain, because we're very complex beings. You know, we have a lot of different aspects to ourselves. And so, but we're one thing. And sometimes we as clinicians can get a little tunnel visioned on what is actually going on with this patient. We look at that patient through our preferred lens. And sometimes when they're not getting progress, it's useful to step back and say, what am I not seeing? This model helps me remember to always look at the whole person. As much interest as I may have in the individual parts, I get very, very excited about having discoveries that are outside of what I'm always aware of. So this is a good way to open the mind and to improve your clinical outcomes, therefore. So I would encourage you, ponder this. A small change anywhere shifts these forces everywhere. It's also why we use multimodal care plans. Why we don't typically just work in one place. We'd like to strengthen the energy and improve the information flow between systems when possible. So I want to encourage you, place this on your desk as a reminder of the interconnectedness of all these health domains. Whenever you see a rod, ask, how am I supporting that pillar today? At MaxWell Clinic, we work to optimize the whole system because just like this DynaMatrix, your best health depends on every element working together in your dynamic life that is like nobody else's. So I hope you enjoy this model, and I hope it brings you joy and curiosity and new insights. Take care. Dr. David Haase with MaxWell Clinic.